Good morning, one and all. A very warm welcome to all of you. Dr. Vidas. And today we are going to start with the program with National Victor School. Already we done a lot of program with this school. Right now all the branches with us. So I welcome Dr. Diaz, and my proud privilege that he is associated with us because he belongs to Philippine. So without any delay, we'll start with the prayer. So yes, Namita Goyal ma'am, start with prayer.
ओके सभा में उपस्थित सभी सदस्यों को मेरा प्रणाम। कार्यक्रम के आरंभ में हम सभी अपनी आंखें बंद करके परमपिता ईश्वर से सभी के कल्याण हेतु कुछ मंत्रों का उच्चारण करेंगे। ओम नाम का उच्चारण पूर्णमदः पूर्णमिदं पूर्णात् पूर्णमुदच्यते पूर्णस्य पूर्णमादाय पूर्णमेवावशिष्यते। ॐ शान्तिः शान्तिः शान्तिः। ॐ सर्वेषां स्वस्ति भवतु, सर्वेषां शान्ति भवतु, सर्वेषां पूर्णं भवतु, सर्वेषां मङ्गलं भवतु। ॐ सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्, मा कश्चित् दुःखभाग् भवेत्। ॐ शान्तिः शान्तिः शान्तिः। धन्यवाद।
Thank you, Namita ma'am.
Thank
We
you.
started with prayer. God grace us and will save our country. With us, the doctor who belongs to Philippine with us. I really thanks doctor, and Kirti Tripathi with us. I want to start with the profile of doctor. Kirti, you please start.
Yes, thank you so much, Sapna ma'am. Yeah, good morning, everyone. Thank you to each and every one of you present here on this lovely morning. To begin with, on behalf of NVPS, I would like to extend my heartfelt gratitude to our Honorable Chief Guest and Speaker of the Day, Dr. Diaz, for being with us on this morning. Sir, I would like to welcome you to our platform, and good evening to you, sir, since it's evening there. So good evening, sir.
Yeah, thank you for inviting me. It's
Thank you.
it's
Yeah,
kind of
welcome,
new to talk with a group of people so far away, but I know that diabetes and COVID has hit India very hard. So it's kind of a good way to get people acquainted with how diabetes affects people who have COVID-19.
Yes.
My background is, I graduated in 1976, if you can believe that, in the
Right,
Philippines.
right. Yeah.
And then,
So
I
it's a
came
privilege,
to the
sir,
United
to have you
States.
here. Besides,
Thank you.
yeah, thank you so much, sir.
Yeah, so I had my training here in the United States,
Right.
both in internal medicine and endocrinology. So yeah, I thought maybe it'd be better to have a question answer format rather than a formal
Doctor, she want to read
presentation.
your profile. Just let her.
Yeah,
Okay.
Yeah.
Okay, Kitty, you please start.
thank you, ma'am. Uh, Besides him, I feel delighted and privileged to take this opportunity to welcome our respected Director Ma'am, Ms. Nidhi Panchal, Manager Sir, Mr. Sanjay Kumar, Principal Ma'am, Ms. Veena Joshi Ma'am, and the facilitator and moderator of this webinar, Dr. Sapna Bansal from University of Delhi, my fellow colleagues, and the dearest parents who are present here on this morning. Before we begin, I would like to throw some light on the profile of our eminent speaker, Dr. Diaz. Though words may fall short of in describing the profundity of his experience in the medical sciences, still I would like to mention few of his accomplishments here. An MD by profession, Dr. Diaz holds an experience of more than 50 years in the field of internal medicine, diabetes, endocrine, and metabolism. Practicing in California since 1991, he is a certified practitioner from the Medical Board of Internal Medicine from America. Now, without much delay, I would request Dr. Diaz to enlighten us
Over to you,
to
DS.
I,
the
Doctor.
forthcoming questions and doubts regarding the same. Thank you so much, sir, for being here. Over to you, Sapna ma'am.
Okay. Thank you, Kirti.
yeah, thank you for
Yes.
inviting me. Yeah.
Yes, doctor. Without any late, we want to know about this diabetes because you are practicing past 40 years. I mean, have a great experience and today having a lot of question for you. So just want to highlight it, what is all about this and, what is all about the precautions. Yes.
Well, yeah, diabetes is unfortunately one of the fastest growing diseases in the world. As we industrialize, as more and more people have availability to uh, readily available food, more and more people get obesity and then diabetes. I'm pretty sure that India has its own diabetes problems that have been growing. Uh, Here in the United States is one of the fastest growing diseases as well. Uh, Diabetes is mainly two kinds. Type 2, which is the more prevalent one, it's associated with uh, lifestyle and food and genetic predisposition, of course, and the type 1 diabetes, which is an autoimmune disease. Both, when you have uh, either type 1 or type 2, they are usually prone to other diseases as well. Like most of people who have diabetes die of heart disease or strokes or cancer. So most of the chronic diseases that's prevalent in everybody else is more prevalent in diabetic patients, especially the type 2s. The type 1s uh, are the same. If you have diabetes long enough, you either suffer from coronary artery disease, strokes, cancer, kidney failure, and all that. Those are the killers of diabetes. Uh, in the more recent epidemic, the pandemic, which is COVID-19, a lot of the mortalities uh, come from or are due to comorbidities and mainly diabetes. And the more other morbidities you have, the higher the chance of you suffering from, severe COVID-19 or death. The death is about 6 times more prevalent. I think that's the calculation that they have versus people who have no diabetes in people who develop COVID-19. So having diabetes and other comorbidities is a very big red flag for people who get the COVID-19 infection. So, so the best way, if you have diabetes, the best way uh, to go through this is to not get the not get the COVID-19, and that's where we think of prophylaxis, prophylactic treatments, and all that stuff. I think diabetic patients should, or especially, elderly diabetic, or if you're more than 60 years old, I think prophylaxis with what they call the IMAS protocol, which involves ivermectin and vitamin D, vitamin C, and zinc, is zinc and quercetin and some other to improve your immune system is the best way to deal with this pandemic. I know that in India, the more recent events showed increased incidence and increased mortalities in people who have contracted COVID-19 there. So I don't know how it is there right now. Is it still are there still a lot of people getting the COVID-19 and getting hospitalized because of it?
Okay,
Yeah,
doctor. As I understand, okay,
we have a less numbers in India.
Oh, you have less. Okay,
Yes.
that's good.
Yeah, that's
Yeah.
very good.
so lifestyle is the
Yes,
most
I-
important problem for diabetes, as I understand. And this time we people are eating, I mean, burger, pizza, chow mein, and other things.
Right. Yeah. Yeah. Especially in India, Indian diet is high carbohydrate diet. It's very diabetogenic because most of the calories are obtained from carbohydrates. Chapati and all these nice Indian cuisine is very high in carbohydrates. So as more and more people have access to it, more and more people will get diabetes.
Right. So we can take the question answer. Please raise your hand. Okay. Harshita ma'am, yes, you can.
Harshit.
Good morning, everyone. Good evening, doctor. My question is, as you said, that diabetes is genetic. So is the diabetes a common hereditary disease? Is diabetes hereditary from mother to father? Or like grandmother had, father is having, and now the child may have it in future? What are the chances and how we can change the lifestyle or diet to reduce its possibility?
Yeah, well, if both parents have diabetes, if you gain weight, you'll get diabetes. It's kind of a given. The best way to prevent it is to decrease your carbohydrate intake. In fact, there's one expert here who is advocating for type 2 diabetics anyway, what they call intermittent fasting. And people who are at risk for it, you can also do this. Intermittent fasting is you just eat maybe lunch and dinner, and you skip breakfast. No calories. You can have like tea or coffee without any sugar. But I don't know how Indians drink their tea or coffee. I think if they follow the British, it is with milk and sugar, right? So yeah, if you can avoid, they're saying if you can do 20 to 50% of your diet as carbohydrates, you'll probably be able to manage to not get the diabetes. You have to have a high carbohydrate diet on on a genetically predisposed person in order to get diabetes. So there's a lot of people even who were on a very high dose of insulin where they put it on very strict caloric restriction. They were doing very close monitoring of these patients who were on 100 units or more. They put them on a very strict 1 meal a day diet with very low carbohydrates. About 18 days after that, they get rid of their insulin. So it's very fast that you can get rid of your insulin by just following a very strict diet. So yeah, that's what I promote to my patients as well, but it's kind of hard because carbohydrates are very good.
Thank you. Thank you so much.
Next, we hear Samriddhi.
Good morning, everyone. I hope you all are doing fine. Good
Morning.
evening, doctor. I have a question that
Good
we
evening.
have read. We have read that there are multiple kinds of diabetes. You just said. So which one do kids get? And can a child outgrow type 1 diabetes?
Well, type 1 is autoimmune. It's also genetic, but there's some antibodies. The ones that they have identified is from the milk of northern European cows, which seems to have similarity to one of the receptors in the beta cells that you develop antibodies to that protein, the cow's milk. It kind of develops antibodies to some of the receptor proteins in the pancreas that will eventually get destroyed because of inflammation and autoimmune response. So that's type 1 diabetes. Type 2 diabetes is just more and more insulin resistance because of one, genetic predisposition, and two, increasing total body fat. The more body fat you have, the more insulin resistant you become. And at a certain point of time, depending on how early you develop your obesity, you will develop diabetes because of insulin resistance shortly after that. So the best way to prevent one person from getting diabetes is to not gain weight, which is difficult, of course, especially because we have easy access to a lot of to a high carbohydrate diet nowadays. So everything is high carbohydrates. Even in third world countries, the diet is already very high in carbohydrates. So the other ones are, of course, related to it is deficiencies in micronutrients. I don't know if you're familiar with that already. As we mechanized our agriculture, the soil that the plants are planted on becomes more and more depleted with micronutrients. So even if we eat very healthy vegetables and all that stuff, the micronutrients, which are minerals and vitamins, eventually get depleted. And micronutrient depletion is also probably one of the causes of diabetes. In fact, yeah, there were animal studies way back in even the 60s where depletion of a micronutrient called chromium correlated very well with development of diabetes in animals. So those are just one of the micronutrients, but I think there are other micronutrients as well as vitamins and minerals. There's 90 of them, and any combination of depletion will probably trigger insulin resistance.
Okay, thank you.
Thank you.
Yeah. Next we have Himani. Yes. Very good question, Prati. Thank you.
Good morning, everyone, all present here.
Morning.
Good evening, sir. Doctor, my question is, are diabetic patients more likely to develop symptoms of black fungus?
Meaning fungal infection in the blood or
Yes,
just any?
black fungus. Are diabetic patients more likely to develop symptoms of black fungus?
Yeah, I mean, you know, any kind of infection, be it bacterial, viral, or fungal, will be more prevalent in diabetics compared to non-diabetics, simply because diabetic people have lowered immune response. Their ability to respond to infections are generally diminished because of one, high blood sugar. Two, it's if you have very high blood sugars, the lymphocytes, the white cells that are involved in immune systems have diminished capacity to respond. So every bacterial or fungal or viral infections are more prevalent in diabetes compared to non-diabetics. Yes.
Thank
So
you,
the
doctor.
answer is yes.
Thank you, doctor.
Yes. Next we have Sangeeta Singh, ma'am. Yes, please.
Very good morning to all. Good morning, sir. There are lots
Morning.
of Ayurveda wellness product for diabetes in the market. So if a diabetic person becomes COVID positive, then should that person stop taking that wellness product? Or what extra precautions that person should take in such conditions?
Well, I am a proponent of ivermectin as the primary treatment for people who develop COVID-19. So if you're diabetic, as first signs of COVID-19 infection, then we should start the ivermectin protocol right away. On top of that, everybody should be on vitamin D, vitamin C, zinc, because those are the things that will make your immune system more robust. So yes, so the first sign of COVID-19 infection, I think they should right away take ivermectin per ivermectin protocol. If you're interested, if maybe Dr. Bansal, if you can give me your email, I can email to you the protocol that is being used here called the IMAS protocol for people who have COVID-19, because that's one of the most effective way of dealing with COVID-19 right now anyway. Yeah.
Definitely, doctor, I will provide you. But I think, yes, Ayurveda, naturopathy, and other sources also helping a lot, because I have seen many patients in my family also. So yes, that is also effective. Yes, we can go that. Yeah. Next, we have Geetika. Yes. Geetika Sardana. Unmute yourself.
Very good evening to you, doctor, and good morning to all of you.
Hi, good evening.
Sir, as you have just said that diabetes patients are more prone to COVID-19. So can you please tell me why exactly happens, like why they are so much prone to COVID-19?
Can you repeat the question? You was kind of breaking up. I didn't get it very well.
Sir, you just said that diabetes people are more prone to COVID-19. So I would like to know the medical reason behind it.
The reason why diabetics are more prone to COVID-19 versus
exactly.
ordinary people. Yeah,
Yeah,
the
yeah.
the
As compared
diabetics,
to.
yeah, diabetics have diminished ability to respond to infections because when you have high blood sugars, the immune system is also down. Just imagine uh, if you have diabetes, it's not only a high blood sugar problem, right? It's also a problem of utilizing the sugar for energy. So if you imagine the mitochondria, which is the factory or the energy uh, producing uh, organelle of a cell, they use glucose a lot for energy. You convert glucose to energy, right? In people who have diabetes, although their blood sugars are very high floating around their blood, it doesn't go into the cells. So the cells are starved when you are floating in syrup. So when your cells are starved, all kinds of cells cannot function very well. So the lymphocytes, which are cells, also have diminished capacity to respond. So when you get an infection, infections are all usually worse and more takes longer to cure and usually more intense. Um, a lot of the a lot of ICU patients here, especially in the United States, have uh, three or more comorbidities. Most of them have diabetes and maybe heart disease or high blood pressure and kidney disease and obesity. Those are the killers of people who have COVID-19. COVID-19 is not very serious in people who are healthy, quote unquote, but very bad in older people and people who have comorbidities.
Thank you so much, Dr.
Most of the young people that I know, most of the young people that I know here in the United States who have suffered from bad COVID infections are obese and diabetic patients.
Thank you so much.
So
Okay, doctor, please check
that's
your voice not audible proper. Please.
Yeah, it's breaking up probably because of my internet, but
Okay.
sorry about that. Is it okay?
Yes, yeah, in
Can you hear me?
technology we can't do anything, but yes, thank you very much. You are
I know.
participating and giving all the answer. And Veena Mishra ma'am also
Yeah.
associated with us and she's listening everything. Okay, next let's come to the Garima Sharma. Yes, Garima, you can ask your question.
Good morning, everyone. Good evening, doctor.
Good.
Doctor,
Good
my
evening.
question is this, can we have a vaccine that can prevent diabetes? Because science says that via mRNA platform, we are able to cure, prevent some diseases. So even diabetes can be prevented?
Well, I mean, I don't know about vaccine, but I mean, the best way to prevent people from developing diabetes is to kind of just keep themselves healthy. Uh, try not to gain a lot of weight because most of type 2 diabetics anyway are associated with obesity. The higher the fat mass, the higher the chance of diabetes. Even if you don't develop the high blood sugars in people, if you're obese, you're insulin resistant, and you can have complications of the insulin resistance itself. Just because the high levels of insulin also kind of protects you. I mean, is detrimental to your health as well. So vaccine wise, it's not an autoimmune disease. So, I mean, the type 1 diabetics, which is autoimmune, maybe there's a chance of developing a vaccine, but we don't know what the exact protein is that precipitates the type 1 diabetes. So we can't really say we can develop some vaccine that will prevent the switching on of the autoimmune system in people who have type 1 diabetes. Type 2 diabetics, I don't think vaccine is the answer. I think it's a more a better answer would be a better lifestyle. Just be aware that a high carbohydrate diet is likely to give you diabetes.
Thank you, doctor.
Yeah, till the
Thank you.
time
Very
no
good question.
vaccine. Yeah, very
Thank
good
you.
question. Till the time no vaccine, we are working upon it, and definitely we will get very soon, because almost, many people diabetic this time. I mean, in every family you will find 1 or 2%. So I mean, that's the ratio.
Yeah, I know.
Yeah. So next we have Jyoti Bharadwaj. Yes.
Very good morning, one and all present here, and very good evening to you, sir. Sir, my question is this: if pancreas is removed, then what all precautions should be taken by a diabetic person, and what kind of complications generally is faced by them?
With people who develop with diabetics who develop COVID-19. Yeah.
No, no, no.
Well,
Generally,
I mean,
if it is
precaution
removed,
generally. Okay.
yeah.
Generally, I mean, the best thing you can do is bring down your blood sugars to a more tolerable level. Meaning, if you can get your hemoglobin A1C down to 7 or better, close to normal, which is 5.6. That's hemoglobin A1C is a marker for diabetes control. It's part of the hemoglobin molecule, the red blood cell hemoglobin molecule that gets sugar in their molecule. So if your blood sugar goes down to around mostly 120 or below 150 most of the time, then your chance of getting ill from infections from other diseases will go down as well. I mean, heart disease is kind of difficult because there are other factors, but mostly like the nerve disease or the kidney disease or the eye disease. That's, diabetes is the number one cause of blindness here in the United States. I don't know what the percentage of that it is in India, but complications of diabetes can be prevented by controlling your blood sugars very well, as well as having a healthier lifestyle. Exercise, uh, controlling your blood pressure. That will prevent the microvascular complications of which is heart disease and strokes, which is the most common cause of mortality and morbidity in diabetic people. So control the blood sugar, maybe lose the weight, decrease the insulin resistance. It's just kind of easier said than done, but if we just change our lifestyle and be more cognizant of what we eat, and it's high carbohydrate diet with diabetes and stuff, then we can prevent perhaps the more chronic complications of diabetes, which are the killers. I mean, blood sugar itself doesn't kill you. It's the heart disease or the stroke or the kidney disease that will eventually produce mortality or decrease the life expectancy of a diabetic person.
Okay.
All right. Thank you so much, sir.
Okay. Yes, doctor, you are
Thank you.
absolutely
Thank you
right.
for the question.
Weight reduce, very important this time because we are not, working upon weight reducing. But yes, next we have Aditya Singh ji. Yes, please unmute yourself, Aditya ji.
Yes, good morning everyone. Good evening, doctor. Doctor,
Morning.
hello. Yeah. Good evening, doctor. My question is that my mother is suffering from diabetes. What are the chances to develop diabetes in me and my siblings? At
Uh,
yes, at
very,
40,
very,
I have no diabetes. Yeah. Please.
very high if you're on a high carbohydrate diet. If your total body fat goes 30 or over, it's more likely that you'll develop diabetes in your lifetime. If your total body fat is around 25, 26 or lower, the chances of you getting diabetes, even if you're genetically predisposed, will actually be zero. So uh, the higher your total body fat, the earlier you'll get diabetes. The lower your total body fat, the less likely you'll develop it. So that's that's a good question, which is, we're concerned of our health when we see it in our parents, right? Yeah, my dad was also diabetic. That's why diabetes scares me a lot.
Okay, thank you. Thank you,
Doctor,
sir.
I do agree with you. I just support your answer. My husband is he's having 5 siblings, so altogether there are 6. Mother was diabetic, and rest 5 siblings are having diabetes except him, because he's maintaining a very healthy life, uh, doing a 10-kilometer jogging every day, maintaining
Yeah,
a weight,
that's
yes, and a very controlled diet. So amongst the 6
yeah.
siblings, he's the only one who is not having a diabetic, since others are having from their parents.
So the good thing though is those 5 siblings, if they because they still have enough insulin floating in them, it's the insulin resistance that the problem. If they adopt the lifestyle of your husband, there's
Yeah.
a good chance that they will get rid of their diabetes. I don't want to say get rid, but it's
Yeah.
literally if they decrease their carbohydrate intake and lose their total body fat to, less than 30, there's a good chance that they won't need any medicines or insulin.
Yeah.
That's proven. Yeah.
That's the good. Yeah. Okay.
So that's the encouraging. If you can encourage uh, your 5 brothers or sisters in law, you follow the lifestyle of your husband, and there's a good chance that they'll be able to get rid of their medications.
Yeah, so, doctor, I do agree with you, but the problem in India is that food. It's a very tempting food habits are the
I know.
problems. So they
It's
more,
it's
yeah,
it's the problem. It's the problem everywhere. It's the
everywhere.
problem
Okay.
everywhere.
So
You're
to
not.
control the
Yeah,
diet, since and to do physical is together is a very tough
right.
task.
Yeah.
Yeah.
It takes time and a lot of effort.
Yeah. Yeah. Yeah.
And it's easier to pop a pill, although it's easier to take 2, 3, or 4 or 5 tablets than to exercise. Although those 4 or 5 tablets really not gonna help a lot. The lifestyle change will help a lot
Yeah.
compared to just uh, popping pills.
Yeah. That's right. The lifestyle is playing a major role in controlling the diabetes, if you have or not to have.
Yeah.
So that's the thing. Okay.
Yes.
Dr. Sapna, you may continue.
Yeah, thank you. She's saying absolutely right. The kind of food we cannot control. Think, okay, from tomorrow we will start jogging, yoga, exercise, but the having food habits, sometimes it's avoid. Anyway, next question we have
No,
Manisha.
but I mean,
Yes.
your religion advocates a lot of fasting. if you just practice Hinduism as Hinduism is preached, you'll probably get rid a lot of diabetes, because if you fast a lot, then your insulin resistance will go down. That's why almost all religion have fasting incorporated in their practice, right? It's not only because it's also a healthy lifestyle, you know.
You're saying absolutely right. In every religion, there is a fasting system. Even I know about my grandma and other people. They used to keep fasting in a day. Out of 7 days, one day you need a cleansing of your body. So automatically, your body will update. Okay. Next, we have question from Manisha. Yes.
Good evening, doctor, and good morning,
Good
everyone.
evening.
As you already said that people who have diabetes, they are more prone to diseases or infections, especially to the COVID-19 infection. So I would like to ask that what anticipatory measures should be taken by the diabetic people if they tested positive for the COVID-19 virus, so that they can help themselves in a better way.
Well, if you have positive, there's an ivermectin protocol where you take ivermectin high dose right away at day 1 or day 2. I think it's a 5-day ivermectin protocol, but you have to incorporate with that high dose of vitamin D, about 2,000 to 5,000 units, and vitamin C, anywhere between 2,000 milligrams to 5,000 milligrams. There's quercetin and zinc, even melatonin. So, if you guys, if you are interested, as I said, I'll send the IMAX protocol so it can be disseminated there. I don't know if you have it there already, but yeah, I can send that to Dr. Bansal, and anybody interested in getting it will have a copy.
Yes.
Thank you,
So
doctor.
yeah, for me, ivermectin is essential, and then the micronutrients and the vitamins and minerals are also essential. So
Okay,
that's
after
the
this
best way
program,
to
doctor, you can
protect.
write all the medicine names so that you are talking about ivermectin or other, COVID or zinc
Yeah,
or something
there's a
else.
whole
Hmm.
there's a whole protocol that I have here that I can send to you, so it's easier. You can follow it
Vitamin
for
C, very
people.
important.
Yeah, vitamin C, vitamin D.
Vitamin
Yes,
D as well.
those are.
Okay,
Yeah.
thank you. Yes, next we have Anjali ma'am. Yes, Anjali ma'am.
Good morning. Good morning to all, and good evening, doctor. My question is, sir, as we have listened or we have overheard that the third wave is going to approach, and this third wave of COVID-19 is going to affect the students or the kids a lot. So what should we do so that we can prepare and students and kids to face this third wave of COVID-19?
I don't know how bad it's going to be. So, but it will be any other viral infection. The antiviral medicine that I mentioned, ivermectin, will probably help, including the vitamin D and vitamin C. Also, have the distancing again, and just get overall make the children healthier. I mean, children does not. I don't know what the experience in India is, but uh, here in the United States, if um, you're, it's almost negative. No mortalities at all in children up to age 17. I think it's 0.003 or 0.005. Uh, Most of the mortalities are in the 70 or older. Um, And so I expect that if you have a second wave, it'll probably behave the same, even if you will have a higher mortality. Children will probably be spared because they have better immune system. The older people are the ones that are kind of more vulnerable. So, but you will also be good to just keep their immune system up, up to optimized by taking, the vitamin C, vitamin D, melatonin and quercetin. So I'll set all those. So I'm pretty sure almost all of those are available in India. The pharmaceutical industry in India is
Yes,
very
sir.
good. So most of the things that we are taking here is probably available there too. So yeah. So
Okay, sir.
yeah send
Thank you,
those,
sir.
and then as we get with the epidemic, whatever wave it is going to be, will be better prepared.
Thank you, sir. Thanks a lot.
All right. Yeah, thank you for your question. It's a very good one.
Thank you, Anjali ma'am. Yeah. Next we have Arjita ma'am. Yeah.
Very good morning to all present here, and good evening to doctor. So my question
Morning.
is, I have two questions. First one is that, yes, we can control diabetes, but can we reverse diabetes and pre-diabetes? And my second question is that since there is a strong need of keeping a control on our food industry, and the advertisement industry plays a lot of role, it's a main factor in playing role for what we eat, for our food choices. So what are your suggestions for improving that? Because I see that right now, the situation in India and overall the world is that having cola, chocolates, chips, it's like smoking. It should come
Yes.
with a warning, injurious to health, So what are
I agree. I
Okay.
agree. It's a choice. Yeah, the answer to your first question is diabetes reversible. The answer is yes, if it's early. Okay. Pre-diabetes certainly is. The way to do it is very cheap. If you eat less, you save more, right? If you eat less carbohydrates, you'll spend less money on food. If you exercise more, you spend less on medicines. So if you change your lifestyle, you'll save a lot of money, and it will also prolong your life. You feel a lot better. So, uh, uh, you know, changing your lifestyle to conform to a more healthy kind of way of life is better. And the problem is, uh, we get our food habits as we grow, right? We mostly eat what our parents give us, and those that we are more familiar with are the ones that we crave. So if we start giving our children healthier food, I haven't had a soda for years now.
That's
because
great.
because because it to me, especially the ones that they're putting in the sodas now, which is high fructose corn syrup, not any sugar. Fructose corn syrup is a poison. It's toxin. It's toxic to the liver. So a lot of these people who drink a lot of sodas that are high fructose corn syrup, they develop fatty liver, and if they start having fatty liver when they're young, when they're obese, uh, they have liver failure in their 20s or 30s. So, yeah, I mean, if you just improve your lifestyle, you live longer, you'll be happier. You don't have to worry about taking 5, 10, or 12 medicines.
So,
So yeah,
there's a
yeah.
lot of self-control needed because the advertisements and the readily food which is there, it's all unhealthy. Most of the time, it's the easily ready food is unhealthy. So they play with our psychology and we pick up stuff which is going to harm.
Yeah, I know. I agree with you. Every time they advertise those toxic foods on TV and all that stuff, they should have a warning. Will may increase the possibility of getting diabetes or metabolic diseases. Just like they warn, you advertise drugs and stuff. They warn you about side effects and all that stuff. But if they advertise Coke, it's they don't say you might get diabetes down the road. So
thank you, sir.
It's marketing. So yeah. Thanks for the question. They're very good.
Thank you, sir.
Thank you, ma'am. Next, we have Anupma Sharma ji.
Good evening, first of all, Dr. Saab, and good morning, all of you. My question is that in type 2 diabetes, should we really quit all the sugary items, or shall we take a little bit in form of sugar in tea and shake? Am I audible?
Yeah, sugar is toxic to diabetics. The more refined the sugar, the worse it is. So for carbohydrates, I recommend, if you have to have carbohydrates, I recommend the root crops, the potato, sweet potato, yam, taro, the carbohydrates that grow under the soil. It's better than those that are refined, like wheat or white bread or any kind of grain. Among the rice, probably only basmati rice will be good. The wheat, I really don't recommend. Any of the grains is not good for people who have diabetes. So it's best to avoid it. So if you have to have carbohydrates, more primitive carbohydrates will be better. Honey is kind of big question because there are some therapeutic things that honey can do, but it is sugar. So if you are a diabetic, you should be refraining from the concentrated sugars.
Or we can take a sugar-free tablets also to using this sweetness?
Yeah, you can. Yeah, you can. The only one that I would recommend would be stevia, which is plant-derived sweetener. The other ones can also. The problem with even if you have diet soda or the sweetness makes you crave for carbohydrates. So you end up eating more carbohydrates if you have even the diet sodas. So sodas really I don't recommend. To me it's a poison.
Thank you so much, doctor.
Thank you, Anupma ji.
Welcome.
Good question. Yes.
Thanks for your question.
Yeah. Yeah. Mausam. Yes.
Good morning, everyone, and good evening, doctor. Now, as we all know that
Hi, good evening.
is related to insulin production, and insulin is a hormone which is secreted from pancreas. If we work upon our pancreas, if we make it a bit healthier, bit stronger by taking some exercise, by doing some exercises like walking, jogging, or by taking some supplements. So is it possible that we can get rid of this disease?
Yes, it is. Lifestyle change. As I said earlier, the insulin resistance is produced by, I mean, there are people who have inborn errors of metabolism where some insulin molecules are defective, or receptors to the insulin are defective, that um, it will not bind to insulin very well, but that's rare. Most of the insulin resistance that produces diabetes related to total body fat. So the higher the fat mass, the higher the insulin resistance, the earlier you'll get diabetes, and the more difficult it is to treat. You know, uh, it's almost impossible. You can decrease your blood sugars with medicines and all that, but if you don't address the insulin resistance, the chances of developing the chronic um, complications of diabetes like heart disease, hypertension, kidney disease, neuropathies, strokes, those are all related to insulin resistance. The higher the insulin resistance, the higher the complication rate. So the way to decrease in general, in most diabetics, the only way you can get rid of insulin resistance is to decrease your total body fat. So the most important thing uh, is to have or eat the food that makes your insulin resistance go away, which is less carbohydrates. Recommendation is 50% of total caloric intake or less. The less, the better. Or eating only twice a day or even once a day will probably prevent developing diabetes in the future. Or if you already have diabetes and it's early and you still have your pancreas are still producing insulin, then there's a good chance that you'll get rid of the diabetes by decreasing your insulin resistance. So if you lose significant amount of weight, then your diabetes will go away. That's why a lot of people would have these gastric bypass surgeries to lose weight. Their diabetes will go away. So yeah, it's possible and it's preventable, but it requires a very disciplined lifestyle.
Thank you so much, sir.
Yeah, thank you.
Yeah, next we have Rishika. Let's come to the quickly because we have a number of questions, doctor, waiting. I think everybody wants to be asked. We have joined approximately 280 participants in this program. So
Wow.
everybody is, everybody wants to ask a lot of questions. So let's come to the Rishika. Rishika Raghav ma'am, yes, you may.
Good morning, all, and very good evening to doctor. Doctor, a few minutes back, you talked about total body fat. If it is 30 or more than 30, then the person is more likely to develop diabetes. So my question is, doctor, is there any test available in the lab to measure or to test the total body fat, or we can get it done at home only? And if it is at home, we can measure. So how we can?
There are instruments that you can use that will measure total body fat. It's called electrolipogram. It's a machine that it's a conductance device. it will calculate your total body fat. But the easier way is you have calipers will measure the thickness of your skin fat in the abdomen, and you just measure different parts of the body, and then that will also calculate your total body fat. So yeah, the gold standard for body fat is to measure you underwater and to measure you on the air, but that's kind of difficult. So there are machines that can do it. The one I use in my office is called an electrolipograph. It just looks like it's a machine that will calculate automatically your total body fat. Yeah.
Thank you so much.
All right.
Okay, one question in chat box. Doctor, can you please name the instrument that you are talking about?
It's lipograph. Electro is electric, and lipo, LIPOGRAPH.
Okay.
Yeah.
Thank you. Next, we have Shikha Jaiswal ji.
Good morning, everyone. Good morning. Good evening, sir. Sir, my father just recovered from COVID. He is not diabetic, but during the treatment, as steroids given to him, so his sugar level increased at that time. So, medicine for treating sugar given to him. But right now, he stopped using those medicine. My question is this: whether he needs to continue that medicine or not? He's not diabetic.
Yeah, well, part of the treatment for diabetes, was he hospitalized for the COVID?
No, not
No?
hospitalized.
So they gave dexamethasone,
Yes.
steroids. Yeah,
Yes.
so the dexamethasone, the dexamethasone is part of the protocol for more serious COVID infection. Will precipitate, will make your blood sugar go up. It's kind of a given. It'll eventually go away. So if your dad is not symptomatic anymore from the COVID, he doesn't need to take the diabetes medicine to bring the blood sugar down. He will just go down as he gets better. He's not overweight, is he?
No.
Is he overweight?
No.
Oh, okay. So yeah, if he's not overweight, you don't need to treat the blood sugar. You just eat a healthy lifestyle and just recover gradually, and once you get out of the long phase of COVID and stuff, the blood sugar should get better.
Okay, thank you so much, doctor.
All right.
Welcome. Doctor, we have many parents with us and they want to ask the question. So, okay, let's start with one by one. Okay, Kirti, meanwhile, you can ask your question, okay?
Yes, ma'am. Thank you so much.
Parents, please open your camera so that I can unmute yourself. Parents, please unmute.
Good evening, sir, once again. Sir, my
Good
question
evening.
to you is, sir, does diabetes affect the psychology of an ailing person, like his mental health and well-being? And if it is
Yes.
so, then what precautions should be taken to ensure his mental and emotional well-being, sir?
Well, I mean, a lot of people who have Alzheimer's disease have diabetes as well, or a lot of diabetics are prone to develop Alzheimer's disease. Can it lead to depression? Yeah, a lot of diabetics also develop some mood abnormalities and stuff. So because it's a hard disease to deal with, just imagine if you have to take 6 or 7 pills in order to control your blood sugar, your blood pressure, your cholesterol. You know, it's kind of depressing sometimes. So the way to deal with that is to have a healthy attitude. You know, that you can conquer your diabetes by having a better lifestyle, and that if you control your diabetes very well, that your life expectancy and your health will improve as well. So you know, there's no medicine to take care of, you know, the depression or the mood problems or the tendency to develop Alzheimer's down the road. But having a healthy lifestyle will certainly help prevent those from happening. But
Okay, thank you so
yeah,
much, sir. Thank
that's,
you.
yeah, you're welcome.
Next question from the
So
director
yeah.
of National Victor School, Nidhi Panchal ma'am, and she's amazing. The way she's running the school, it's really hats off her. So with my proud privilege, I call, Nidhi Panchal ma'am to ask the question. Yeah. Please unmute yourself, ma'am.
Yeah. Well, thank you, Dr. Sapna. Good evening, doctor, and good all the
Hi, good
members.
evening.
Good evening, doctor. I would like to thank Dr. Diaz on behalf of National Victor Public School. Thank you so much, doctor, for your time and information provided to all the staff members and parents. Doctor, I would like to ask you, one of my relative got cyst in his pancreas caused to diabetes. What precautions we should take to prevent it and how it should be treated?
What kind? You develop pancreatitis, pancreatic pseudocyst?
Yeah.
What? Pancreatic pseudocyst?
Yeah.
Unfortunately, pancreatic pseudocyst, the pancreas auto digest because the exocrine pancreas, the pancreatic juice kind of gets out of that canal, and because it has enzymes that will digest protein, so the beta cells are protein, and so there's if you develop diabetes, that means that enough beta cells were destroyed so that you develop diabetes. Is he overweight?
No.
Is your no?
No. He's approximately 48.
Yeah.
And
I
age
mean,
of the old. Yeah.
Yeah. So demand for insulin by the body is always dependent on insulin resistance, right? So if you decrease your insulin resistance by decreasing your total body fat and increasing your muscle mass, there will be less stress to the remaining beta cells. But unfortunately, there's really not a lot you can do to regenerate the beta cells, although they're saying that maybe that's possible, just maintaining low blood sugar, blood sugar which is in the range of good blood sugar control will decrease demand for insulin from the body to the pancreas. So the lesser you demand, the better the beta cells will be. Sometimes those beta cells that are remaining will kind of get better and produce more insulin. If his weight remains good, like less than 30% total body fat, then the demand of the body to the beta cells of the pancreas to produce insulin goes down, so it doesn't have to work very hard. Is he getting insulin right
No,
now? Is he?
not yet.
No?
Only tablets
So-
taking.
Okay. Yeah. So yeah, the lower the blood sugar, the lesser the demand to the beta cell, the healthier the beta cells will become. And sometimes making whatever remaining beta cells she has from the acute pancreatitis that he developed can how long ago was the pancreatic pseudocyst, the pancreatitis? How long ago was this?
Approximately 2-3 years ago.
Oh, okay. So how is his blood sugar control?
Yeah.
It's good.
So, yeah.
Okay. Yeah, I mean, just controlling the blood sugars very well, eating very well, exercise and all that, increase the muscle mass because muscle is more insulin sensitive compared to fat. So by just doing it will send the demand to the beta cells and maybe make the beta cells have a chance to recover.
Okay.
So that's about the most that you can do for people who develop diabetes from pancreatic pseudocyst.
Thank you, doctor. Thank you. I'm
Oh,
finding it.
I'd like to congratulate you though for the job that you're doing for the school, and a well-run school produces very good students, right? And the future of the country is dependent on how good our youth is going to be. So for that corner of India that has youth that has learned from your school, then congratulations.
Thank you, doctor. Thank you once again. I am finding it very informative and very valuable. And I am sure this information will certainly add some value to all the participants. Hope to see you for more such programs in our other branches also. Thank you so much, doctor.
I hope. Thank you.
Ma'am. Next, we have Kritika Agrawal. Yes, Kritika Agrawal. Yes.
Good morning, everyone, and good evening, doctor.
Good morning.
Doctor, I just wanted to know for high diabetic patients, how much insulin injections are fruitful? I mean, what is the better option? Which is the better option, the tablets or the injection?
It depends. If there, what I usually do is get if the patient is not yet on insulin, I get a protein called the C peptide, which is if they're not on insulin, you can get an insulin level in the blood. If the insulin level is still very good, that means that the problem of diabetes is insulin resistance. So if you just put more insulin, it doesn't really solve the problem. What you need to do is decrease the insulin resistance. If the pancreas doesn't produce any insulin anymore, you don't have a choice. You have to do the injection. So it depends. If the person still produces insulin, my therapy is to make the body more sensitive to the insulin that he is producing. But if he doesn't have any insulin anymore, then you have to have insulin. So it depends.
Doctor, is there any side effects of getting injections every day?
Insulin, insulin resistance, high insulin levels is atherogenic. It makes the lining of the arteries become irritated. It's atherogenic. So a high insulin level is one of the causes of developing coronary artery disease. That's why it's really very important to decrease insulin resistance, because hyperinsulinemia in people who are very resistant to the insulin is atherogenic in general, meaning that it causes atherosclerosis. So one of the reasons why you develop coronary artery disease and strokes and high blood pressure and all that is because of insulin resistance. So, and high insulin levels. So the lesser the insulin resistance, the lesser it will take for insulin to control your blood sugars, the better it is for the individual. So even in people who get insulin injections at very high doses, they have increased incidence of developing coronary artery disease. So the higher the insulin resistance, the higher the incidence of coronary artery disease. So even if they're already insulin dependent, it's still better to lose the weight and decrease the insulin resistance.
Okay. Thank you, doctor.
Well, thank you for the question.
Thank
It was very good.
Yes. Next, Veena Mishra ma'am. Veena ma'am, I'm unable to see you, Veena ma'am. Veena ma'am, okay. Please unmute yourself, Veena ma'am. Okay, Athar wants to ask, past 1 hour, he want to ask the question. Okay, over to you, Athar. He's our student, he's very much excited to ask the question. Okay, Atharva. Okay. Okay, say. Your voice not audible, beta. Just check your mic. Let's come to the end because I think time already, passing. And yes, Veena Mishra ma'am.
Ma'am, I'm 7.5 years old.
Okay. What do you want to know?
I want to ask, as the third wave is approaching third, so what we can do to protect ourselves and what I can do to boost my immune system.
Okay, doctor. Okay, I'm going to repeat you. The Atharva, I can see is very cute and wants to know about the third wave and wants to know how I can save and protect myself and my family. Very good question, Atharva. Yes, doctor going to reply you. Yes, over to you, sir.
Okay. Well, thank you for the question. The way to improve your immune system is to have a healthy lifestyle and get nutritious food. Nutrition is very important in developing a good immune system. So you have to get proper vitamins and minerals. There's about 90 essential nutrients that we ingest that will keep us healthy. So the more of those that you get, the healthier you'll become. So the other thing that you need to do is get away from junk food because those are poisons. So eat healthy. No sodas, no chips, no high carbohydrates, no high sugar foods. That if you do that, you will keep yourself healthy, and your chance of having the COVID infection or a bad COVID infection will be very low, especially in children. Thank you for the question. It was very good.
Very cute children. I can see they have a lot of questions, but yes, we'll go to the next session because time has the limitations. So let's come to the prayer. I think Veena ma'am, if you are here, I just want to Veena Mishra ma'am, I think might be there is a network issue. Okay, let's yes, Veena ma'am. Yes, Veena ma'am, with your question and valuable suggestion.
Ma'am, just want to say that principal ma'am is unable to unmute herself. So please.
Yeah.
Oh, no, she's go ahead.
Dr. Sapna, thank you. Thank you so much, Dr. Diaz. I just, on behalf of this platform, first of all, I just would like to salute all the doctors, not only from India, from all the world for their incredible work during this COVID situation all around the world. Thank you so much, and a great salute to all the doctors. Thank you, doctor.
Thank you very
Thank you so much. And then what
We
I have
appreciate it.
concluded, yeah. What I can conclude in today's session that what all I have learned from doctor is that one can control diabetes, can do or can keep away himself or herself from diabetes if follow strict diet plan, regular exercise, and maintain weight. So am I right, doctor? These three things if you follow?
Yes.
Yeah, a proper
Yes.
nutritive diet, exercise, and control over weight. So three things can keep us away from diabetes despite of that we have from heredity or whatever reason is that. So thank you so much for all the participants. And thank you once again, doctor, spending a valuable evening with us. Thank you.
Yeah. Yeah. Thank you for inviting me. And it was a very rewarding conference. And I'm glad that a lot of people who have questions have been answered. And I hope that the answers that I've given to them will help them deal with their diabetes as well as the serious pandemic that we are going through. We'll all be better people, and we'll all get healthier.
Thank you,
And thank you,
doctor.
Dr. Bansal, for
Thank you,
moderating
thank you,
very
thank
well.
you.
Yeah,
Thank
it's been
you,
a
doctor.
pleasure.
Yeah.
Been a
Okay,
pleasure.
let's come to the end. Okay, with Namita Goyal ma'am, she will start the.
थैंक यू मैम। कार्यक्रम की समाप्ति पर हम सभी एक बार फिर परम पिता परमेश्वर को धन्यवाद देते हुए सभी के जीवन को सुखी बनाने के लिए और सभी को नेक रास्ते पर चलने के लिए प्रार्थना करेंगे। अस्तो मा सद्गमय, अस्तो मा सद्गमय, तमसो मा ज्योतिर्गमय, मृत्योर्मा अमृतम गमय। हे ईश्वर, हमें बुराई से अच्छाई की ओर लेके चलिए, अंधकार से प्रकाश की ओर लेके चले और मृत्यु से अमरता की ओर लेके चले। ओम शांति शांति शांति। धन्यवाद।
बहुत बहुत धन्यवाद नमिता जी, पुनः बहुत बहुत धन्यवाद। थैंक यू वेरी मच निधि मैम, थैंक यू वेरी मच वीना मैम, थैंक यू वेरी मच एवरीवन, faculty, student, teacher, parents, everyone. Thank you very much from the bottom of my heart, and a special thanks to Meenu Maheshwari ma'am. Okay, and doctor, I really appreciate the way you have explained. Thank you very much.
Thanks for inviting me, and I hope that